My guest tonight is the ever delightful Dr. Zoran Becvarovski. Now, let me just fill you in of how I got to meet Dr. Zoran. I was suffering chronic tonsillitis since I was a child, like really, really bad, and it came in waves. And there was a stage in my life where I was literally on antibiotics all the time. I never got off them, and I knew that was a dangerous place to be because, as we know, you build up resistance, or so I thought. And I actually went to an ear, nose and throat specialist who said to me, he said, "Mark, if I were you as an adult, I'd do anything but have an adult tonsillectomy. I'd rather stay on antibiotics all my life." I thought, that can't be right. And then I went through such a bad stage, I literally thought I was going to die. I stopped breathing one night. I was that sick. And I literally ended up going to Dr. Zoran because I could get into him. And I ended up in a private hospital on antibiotics, intravenous, and I was really, really sick boy. To cut a long story short, I had the operation, I had the tonsillectomy, and I have never looked back. So tonight we're going to inform you on a whole lot of things to do with ears, nose and throat. Dr. Zoran Becvarovski, welcome back to the show. It's so good to have you here.
Thank you very much, Mark, and good evening to the audience.
Okay, I'm all ears. Are we talking ears to start with?
We are indeed.
Let's start.
Well, how do we clean the ears? I mean, do we need to clean the ears? The ears are a self-cleaning mechanism. We do not need to clean the ears. If we use those fancy objects to clean ears, called cotton buds, a packet such as this, all we do when we're using cotton buds is pushing the wax back in. It wants to come out, we should push it back in, it compacts itself, and all of a sudden we've got a plug of thick wax, not to mention the other problems we can use. Now on the back of the packet of cotton buds, it says, under no circumstances should this product be inserted into the ear canal.
But that's what everyone does with them. Now I don't. I've never used them because I don't like the feeling of putting the cotton bud into my ear. And I thought it was dangerous, like I might poke my eardrum or perforate.
Well, I see one perforation of the eardrum a fortnight. Classic example.
What, due to cleaning?
Due to cleaning. A lady had got out of the shower, and I'll never forget, as a registrar, you know how the ladies put those towels around their head. She's cleaning her ears in front of the mirror, and the towel was falling down. She would go and bang, perforated both eardrums at once.
Oh boy.
I saw that patient.
Ouch.
I've seen children basically where mum's cleaning their ear and the door, someone opens the door and bumps the elbow, perforated eardrum. And this happens. Cotton buds should not be used in the ear canal. They are not designed to do that. No structure, and we all know this one, smaller than the elbow, should be inserted into the ear canal. So leave the ears alone. It helps. The ears are a self-cleaning mechanism. If there is no perforation, it's quite safe to put a little bit of baby oil or olive oil every Sunday night into the ear canal, which helps soften, good old grandma, it helps soften the earwax, helps the earwax come out by itself.
So what do? You put your head on the side and you put what?
There's a couple of drops of baby oil. You can
Baby oil?
Yeah, a dropper from the chemist,
Really?
or olive oil. It softens up the wax and lets the wax come out easier.
What about those Indian earwax things? Have you
They
ever
don't
seen
work.
that?
They don't work. I mean, ear candling does not work. And actually, I believe ear candling is unsafe.
Okay, so don't go near ear candles.
No,
And that's coming from a doctor.
Absolutely.
Okay, so just a little bit of olive oil or baby oil or something like that in the ear.
Yep. We've just had our season of the ear canal infections. I mean, in places like Sydney and Melbourne and Brisbane, we're close to the water. In warm environments, a lot of swimming. We're getting a lot of the swimmer's ear, and that is the infection of the ear canal. So as we all know, the ear has three parts. We have an outer part, a middle part, and the inner part. And sounds come from the outside. They hit the eardrum, which moves the little ear bones, and it converts the mechanical energy to electrical energy, just like a telephone. And that's how we hear up to the brain and the brainstem. So if we talk about ear canal infection, that is swimmer's ear, classically happens in the warm environments, indoor heated pools are where the bugs are, sticking stuff in the ear to try to give it a bit of a clean, scratch the skin, scratch the surface. All of a sudden we've got an ear canal infection.
So I swim in a heated pool to my lads, and I also put a plug in. So am I literally pushing the wax in as well as risking
the
bugs?
answer is potentially yes. However, if the ear canal is nice and clean, and if one was doing this sort of thing, if there's no problems with ear infections, because don't forget, the wax is actually there for a reason. It's got antibacterial properties, it's got the pH is quite low to decrease ear canal infections, so that if the wax is there and it's not too plugged up, they're not going to get into any problems. On the flip side, if someone is having problems with ear canal infections, then basically they can use some aqua ear, provided there's no hole in the eardrum. Aqua ear is basically an alcohol product which actually evaporates and dries up the moisture.
I've used that, yeah.
In the middle ear, the most common problem that children get, I mean, 80% or 90% of children by the age of 3 will get a middle ear infection. It is the #1 operation in the world. I mean, it's the most common operation in the world, where we basically make a tiny incision, a very, very small cut, the grommet operation. operation, the grommet operation, a tiny little cut in the eardrum, which we suck out all the fluid that builds up in the middle ear, and we put a little plastic tube in there called the grommet. And the grommet's right there, little structure just there, little plastic tube, and that little plastic tube is a little port for that fluid to come out when it builds up, and also for fresh air to come in and actually help the middle ear breathe.
So how many of these operations would you do? A lot?
Yesterday we did 4 grommet operations, and it's a very, very common, like I said, the most common operation in the world.
And
middle ear infections, antibiotic is the number one cost of antibiotics. Over $1 billion per year in America is spent on antibiotics for middle ear infections.
$1 billion on antibiotics for that one particular type of infection.
Correct.
Was I right at the start of the show when I said, for example, with my tonsillitis, that being on antibiotics forever and a day is not a good thing?
Of course not. I mean, basically, it's a poison going into your body. And on the flip side, if you're having recurrent infection, that's poison also circulating through your body. So you've got 2 poisons. One's the bacteria and the other one's the antibiotic. If you can fix it with surgery, I mean, we're not saying everyone should have an operation, but we're saying most of the time these things are treated with antibiotics and they get better with antibiotics. Thank God, 80% do get better with antibiotics. But the ones that don't get better, I mean, they've done a study where they looked at children that had fluid in the ear. If you get your head and you stick under the bathtub and you try to hear what did you say, if someone said hit or fit or miss or missed, you can't understand the f and the m and the s. If a child is trying to develop normal speech and language at that age, in that crucial first 3 years, and they're getting this blocked up, I mean, that's going to affect their speech and language development for the future. They've actually done studies where they've looked at children that had middle ear infections as youngsters that were not treated versus children that were treated, what sort of jobs they had in 40 years' time. They found the children.
That's amazing.
They found the children that had no middle ear problems or were treated promptly had better socioeconomic status, had better jobs, and so on, versus the ones that didn't.
So the implications are literally lifelong.
Absolutely.
From this sort of thing.
Hearing is vital for speech development at a young age.
But in terms of the grommet, Zoran, what happens to the grommet itself?
Okay, so what happens basically, we make a little incision. Now, the beauty about the perforated eardrums, even from cotton buds or for whatever reason, it heals up pretty quickly. I mean, if I made a cut in the eardrum, 24 hours later, the eardrum closes. For middle ear infection, it's like a pimple of the middle ear. Now, you don't want that pimple to stay there. What we want to do is for that eardrum to be open so the fluid can actually drain. And that's how the grommet works. It actually keeps the eardrum open. And they stay in for anywhere between 3 months to 3 years, most commonly around 9 months. And the body sort of extrudes it, the eardrum closes over, and most of the time, one set of grommets, and that's done.
Now, in terms of the ear as well, and this is something that you point out to me, which I had never heard before, and that is the link between smoking and ear problems.
Well, basically, there's a lot of studies that have been done that show secondhand smoke in children blocks the ears and increases the number of ear infections. There's no question, there's no dubiety about that.
Because you automatically assume that it's going to be a lung-based infection if it's secondhand smoke. You never ever think about the ears.
Well, the ear tube the ear breathes through is extremely tiny. I mean, it's only a couple of millimeters wide. If you put the smoke in the nose blocks off at the very back. In little children, so it's a crucial diameter. Blocking it off further, all of a sudden you block the drainage pathway and you increase the number of ear infections. There is no safe smoking limit. I mean, there's no such thing as, a little bit of smoke's okay. Zero smoke's okay. When it comes to ears, it comes to nose, it comes to throat cancer, it comes to lung cancer, it comes to cardiac disease. Any of them, I'm very, very passionate about smoking and its health implications.
But you add a whole other level to when you start talking about the effect on children.
Absolutely.
Because I think a lot of parents out there, they might think to themselves, okay, I'm smoking, I'm doing damage to myself, but you wouldn't assume that a small child next to you is necessarily having problems with their ears.
Absolutely.
Which in terms, as you say, leads to other problems which in years to come has implications in terms of the whole life.
When I was in America, my boss used to say to the patients, don't smoke 2 weeks before and after the operation. And I said to him, Dr. Cartouche, I said, why do you tell the patients not to smoke beforehand? I said, because box eustachian tube. So I went home that night and looked it up and we did some research on it. We found no one had actually studied the smoker themselves. So we actually studied the smoker themselves. We were the world's first people, the unit that I worked at in Michigan, to prove that the actual smoker, if they smoke, has a 3-fold increased loss of having perforated eardrums, having problems with the middle ear, and also having a hearing loss in the long run.
Zoran, we'll be back after this very short break. Don't go anywhere because we have a whole lot more to tell you, and this is informative, fabulous stuff on Mark My Words. Welcome back to Mark My Words. I've got Dr. Zoran Becvarovski, who's my special guest tonight, and we're talking ears, nose and throats. Dr. Zoran, what are we moving on to now?
Well, Mark, I thought we'd talk about snoring and the snoring child. I mean, does your child snore? What is snoring? Snoring and sleep apnea. What is snoring? Snoring and sleep apnea are a spectrum. No snoring, choking, not breathing at all. And it's a spectrum of normal snoring, a little bit of snoring. It's normal to snore a little bit. But you can have mild snoring, which is mild sleep apnea. You can have moderate snoring, which is moderate sleep apnea. You can have severe snoring and choking, which is severe sleep apnea. In other words, you can exchange the words of choking and sleep apnea. Now, what causes these in children? I mean, the most common cause are blocked nose from adenoids and what we call turbulence in the nose, and also from big tonsils in the back of the throat. And we know now in 2012, it's an area that we actually really coming out to understand even more. I mean, we used to say the tonsils are there for a reason. Well, they are there for a reason. The tonsils are samplers. They actually sample the environment. So when a bug comes in, the tonsil makes antibodies, we can fight the bug the next time. But on the flip side, if those tonsils are getting recurrently infected, they're becoming sick, those tonsils need to be removed for recurrent infection. Now, we're learning in 2012 and 2011 that children that have sleep apnea, in other words, that are choking at night, got two big lumps in the back of the throat, which are arousing them at night, not letting them sleep properly. They're decreasing the amount of oxygen. I mean, I've had children where they wake up 20 or 30 times an hour. And that basically, I mean, if you haven't slept a couple of minutes or wake up a couple of times to go to the bathroom in the middle of the night, you feel a bit unusual sometimes if you haven't slept enough. Imagine not sleeping all those times. And the studies are showing that children, it's affecting their schooling, it's affecting their intellectual learning, concentration, and we're finding that we can diagnose this condition now a lot better. We can treat the children, we can treat obstructive sleep apnea in children, and really with a common operation. I mean, every operation is a complicated operation, but it's a common operation. And as you know, the child will then be able to sleep better, perform better. And a number of parents that have said to me, I mean, ever since they took the child's tonsils out, school's better and they're living better, and they're not taking all these antibiotics when they're getting recurrent infections.
Yeah, but Zoran, we went through this stage I know when I was younger, where they simply wouldn't take tonsils out. And I think that was an enormous problem, not taking tonsils out.
Well, you're right, Mark. I mean, we don't take tonsils out just because they're big. That's the bit we're all missing. So we don't take tonsils out just because they're big.
So at what point do you say
Exactly.
enough's enough?
So
they've got to come out?
Yeah, we've got to have a reason. And the reasons are recurrent infection, or the sleep apnea business, or, let's say it's interfering with children. I mean, every time they're trying to swallow, they're gagging on their food. Or little Johnny doesn't want to eat meat because he wants to chop them in tiny pieces. He's not getting enough iron in him, and so on. And so these are the things that we're learning about tonsils in 2012, and that they're actually making a difference to children's lives.
Well, apparently, and so I've been told, because you don't hear yourself when you sleep. But I used to snore. I don't know how bad it was because it was never taped. Well, I have taped someone else snoring, but that's another story. And then after you took my tonsils out, it stopped. So it was obviously that was the cause of the snoring.
Absolutely. Yes.
So when people go out and they buy those little tabs just to open up their nose and all that sort of thing, are they sort of missing the boat, heading in the wrong direction?
Oh, look, I mean, there's multiple causes of snoring. It's a pipe that basically comes from the nose backwards and from the mouth backwards, and depends whether there's an obstruction. And if everything is open and someone's thin and slim and all they've got is a bit of a blocked nose, yeah, okay, those things would work. But if someone's 150 kilograms and they've got massive tonsils and a big tongue, and every time they fall backwards, tongue backs and they're choking, a little bit on their nose is not going to make that much difference, unfortunately.
No, I wouldn't have thought so. So they're heading in the wrong direction. So the parents out there who are watching, if their kids are waking up continually during the night and it's a problem, get on top of it and get to an ear, nose and throat specialist?
The symptoms are snoring at night, bedwetting.
Bedwetting?
Bedwetting,
Explain the link between bedwetting and that.
Well, basically, there's a hormone in the brain that basically gets excited when the oxygen level drops, which predisposes to bedwetting. Bad dreams, sleepwalking, waking up tired in the mornings.
I think I've suffered from all those things at one point or other in the past week.
Tossing and turning. I mean, little Johnny's tossing and turning all night. Sweaty at night. They're all symptoms of the body working hard to breathe, with all the muscles and so on, the activity being high, and then predisposing literally the body working hard, and because they're choking literally at night.
I think there's so many people out there doing what I'm doing right now. It's a bit of self-diagnosis, and you're all out there thinking to yourself, "Oh, hang on, there's something wrong with me because I have some of these symptoms."
It's called the medical student syndrome.
Oh, is it really?
Yes, it is.
Tell me about that. What?
Well, the medical student syndrome is when you hear some symptoms, you say, "Oh, geez, that could be me." Oh, yeah, it's not uncommon.
Okay, so get your kids to a doctor if they're showing signs of their symptoms. Okay, what next?
Well, Mark, the other thing I think is important to mention, I mean, we've spoken about our children a lot. Hearing loss in 2012 is very, very common. It's the ears, not the person. It's the ears, not the brain. It's just the people that are having some problems with the hearing. And all they need is to see the local doctor, be reviewed by an ear, nose, throat specialist or the local hearing company, and get some hearing aids. And they're extremely tiny. I mean, they're invisible in 2012.
Yeah, but do they work? Because I know so many people who have a hearing aid and refuse to put them on for one reason or another. And it's so frustrating for those of us around them. It's this battle you have with people who have or need hearing aids.
Well, the way I ask my patient and prescribe hearing aids, I simply say, do you have problems communicating with your friends and family? Are people always saying what? And if you're asking that question all the time, then you need some help. But regardless of what the hearing loss is, if you're living on your own, or there's not many people, and you're interacting well, and you're hearing people what they've got to say, your friends and your family, that person's not going to put a hearing aid in the ear, no matter how good or bad it is. If I have a sore back and I need a walking stick, I will use that walking stick. If my back is not that sore, I'm not going to use it. So basically, the hearing aid patient, the one that needs a hearing aid, is the one that's constantly asking what, why. That basically, the friends and family having communication with. I've had a patient where we prescribed the hearing aids, and quote unquote, he has said, it has changed my life. My wife is no longer angry with me. I'm a much happier person because I can hear everybody.
It makes a big difference. And it's also the impact it has on people around them as well. Because the lifestyle of those around them becomes very, very difficult if the person can't hear. I'm talking to my mother particularly if you're watching this show.
And Mark, let's face it. I mean, sometimes we can't hear somebody, not because someone might think they're not smart enough. I don't want to use the dumb word, but you know,
that's it.
That's it. Whereas it's not because someone's not smart enough. They didn't hear them. How are they supposed to respond?
Well, you made the great point earlier, and this is about children, about delayed development, for example, or speech patterns, that sort of thing. Now, in years past, they might have just assumed the child's not particularly intelligent without realising that it is a physiological problem that's going to impact their education and their intellectual development.
Absolutely.
What about adult tonsillectomy? Because I remember when I had mine, I had people I knew who were old medicos, saying to me, don't get it done, it's awful in an adult. Is that true, or is that an urban myth?
No, here's a classic example.
Exhibit A.
It goes back to the amount of problems that people are having with their tonsils. If they're recurrently getting infected, time off work, in hospital, antibiotics, I mean, you've got to do something about it. On the flip side, if it's 1 or 2 episodes, not that severe, and they have some antibiotics and they get better with it, hey, do absolutely nothing.
Look, before we go tonight, Zoran, just a very, very quick plug for your Gasnier Foundation.
Thank you.
It's never too late. Tell people what it's for. It's to buy a PET scanner for St George Hospital.
Basically, the Gasnier Foundation, we're trying to buy a cancer machine that can diagnose cancer earlier. It can monitor its spread earlier. It can help treat patients. It can save lives. The Gasnier Foundation, that is www.gasnierfoundation.com.au. You can go online, learn a lot more about it. You can make some comments. Mark Gasnier is pretty cool. He actually responds. A great man. And also you can make a donation online. And we're trying to buy this cancer machine for our hospital.
Zoran, thank you very much for being on the show. I hope to have you again sooner rather than later. Very, very big thanks, to my guest, Dr. Zoran Becvarovski tonight. An interesting and very, very compassionate man. If you want to rant, rave, or just get something off your chest, write to me, mark@nonpctv.com. Until I have the pleasure of your company, next week, stay safe, take care, and remember, this is the place where I say what you're thinking. Mark my words.